Hello, everybody. I am Dr. Andrew Neville, and welcome to our live Q&A, where we're going to talk about adrenal fatigue, what it is not, and all the misconceptions and misunderstanding there is out there about that. While I get started here, just give me a couple moments for my team to check some tech things. Hopefully, they will let me know if we're good to go, audio and video, on the various platforms. So we're going to talk about adrenal fatigue. I've got a list of questions that have come in prior to this event. We prioritize the patients that are in our programs, whether it's Jumpstart or Core or even Core Plus, so those people can get their questions answered. But by all means, as you join in, say hello. Tell us where you're from in the comments. Let us know. We're always curious about, who we're connecting with. I've got patients all over the country. Thank you, Suzanne. Seems like we're good to go on our platforms. So got patients all over the country. We're trying to get as much information out there about adrenal fatigue, what it is, what it isn't, why people don't understand it, whether that's conventional medicine or alternative medicine. And even if, your doctor might understand what adrenal fatigue is, they don't really fully get it, unfortunately. And we'll talk about why. So I've got this list of questions. Let me just double check here. I guess I should say, hopefully this is somewhat obvious, but this communication in a live Q&A does not equate a doctor-patient relationship. Of course, I'll give you general answers, but I'm not your doctor. You should check with your local clinician, as always, or your personal physician. Okay. Okay. So let me find my question doc, pull that up, and we're going to jump into it. So Hannah says, with adrenal fatigue and hormone imbalance, how does that produce acne? Have you had a patient get clearer skin? Thank you. Yeah. So adrenal fatigue, both adrenal fatigue and the hormone imbalance that stems from adrenal fatigue will cause problems with acne. One of those issues has to do with a vitamin B5, which is pantothenic acid, which actually gets depleted with stress physiology. It's really important that we use up a lot of B5 when we're in stress physiology, starting to create all these adrenal hormones. Turns out B5 is actually really important for fat and oil metabolism at a cellular level, especially in the follicles and the sebaceous glands in and around the face. So B5 deficiency that comes from adrenal problems can actually contribute to the acne. Now, the other side of that, so I've had, patients, every one of my patients is doing, multivitamins or at least getting some B5. So, we're using that thing as a supplement, no matter what. That's only one small piece. The other side of it is the hormonal effects that stress physiology has. So, especially in women. In women, a good majority of a woman's testosterone actually comes from her adrenals, not her ovaries, right? And it's that testosterone, right? That male dominant hormone. This is why kids start to get acne once they hit puberty. All of a sudden, those sex hormones are kind of cranking up, primarily testosterone, or it's metabolite called DHT, which is a stronger form of testosterone. When those hormones are out of balance, they will hit specifically the sebaceous glands, and it could be the face, could be the back. So we see acne all the time with regard to adrenal fatigue. And yes, by fixing the adrenal problems over time, absolutely clearer skin should happen. So it's a common symptom and absolutely can be fixed. Amanda says, does the MTHFR gene mutation play a role in adrenal function? Kind of. So MTHFR, right, is a very common genetic snippet that a lot of us have in the country. I mean, it is so common that I pretty much assume an MTHFR SNP or dysfunction in my patients and treat accordingly, just kind of bypassing that glitch and using activated Bs. The thing is, when we're having a conversation about genetics and genes, we also have to have this conversation about epigenetics. And epigenetics is basically which of those genes are turned on and off at any certain time, because we express a completely different set of genes when we're in stress physiology, right? Fight or flight, compared to when we're in rest and digest physiology, right? The cellular genetics here are for survival and energy production and healing, and not healing, but fighting basically. The healing side is over here. So when we shift our physiology, we actually flip off some genes and flip on some other genes, including the expression of MTHFR and all these other genetic snippets. So it's a piece, but it's a pretty small piece. And certainly I wouldn't consider it a causal factor for adrenal fatigue, because there's most of the country has an MTHFR SNP or mutation, but most of the country doesn't have adrenal fatigue like this, right? So yeah, there's a connection, but it's loose. Okay, Nina says, and welcome everybody as you join in. Just let us know where you're from. We like to hear where you're from. Put that in the comments and reach out. If you have any questions, please leave them in the comments section. I am kind of trying to get through this big old list I have, and I'll do my best to not be quite as long-winded as I may be. Yeah, we'll see about that. Okay, Nina says, how do you get the balance right between pushing through and resting? Sometimes when I push through, I crash. Sometimes I gain more energy. There's no rhyme or reason to it. Thanks. All right, Nina, it's pretty easy. Don't push. Don't push. Whenever you push, you have to go to the well to get the extra energy to push. Now, in that well, stress hormone, right? And for most of us, our well isn't dry, right? We're functioning. Maybe we're functioning at 50% capacity. Maybe it's 30, maybe it's even 70. But if you have a day that asks you for 10% more, well, you'll find that extra 10%, but you do have to go to the well to get it. And in that well is just a bunch more adrenaline or whatever to get you through that added demand. So now you're activating the system that we're trying to calm down and settle. So pushing, when you have adrenal fatigue, pushing is not what you want to do. You don't want to push through it. That's the worst advice that anybody could give you. Although it's common advice, right? Most of us have been raised with that kind of old school kind of thinking, right? Where you just push through it, right? You fall down, you get up, dust yourself off, and just go for it. That is the exact wrong advice to give anybody with adrenal problems. Rest, and more rest. And instead of pushing, you want to pace. Don't push, pace. Pacing just means take breaks. Do a little, rest a little, do a little, rest a little, do a little, rest a little. You can still get a lot done, but do a little, rest a little, right? That's really the key. Don't push. Kim says, am I more susceptible to viruses and infections while in adrenal fatigue? I caught a cold and haven't been anywhere and got a colon infection in the past month. Can viruses and infections also cause inflammation to flare? Sure. I was doing well, and then bam, back to back, and my inflammation is back. Okay. So adrenal fatigue, terrible name for this condition, but we'll call it adrenal fatigue. What it really is a stress response system dysfunction, which I talk about ad nauseum on all the videos on my YouTube channel, especially on my mini course. So if you want more specifics about that, by all means, go to the YouTube channel and check that out. A stress response system dysfunction controls our physiology, right? So there's the hormone side, the nerve side, the limbic system, and the brain running the show. When we're in stress physiology, right, the limbic system's perceiving stress, telling the hormones and the nerves, there's a tiger. We turn on the organs of fight or flight. We turn off the organs, most everything else that's not so important. One of those is the immune system, right? So suppress the immune system. now you're going to be vulnerable to all kinds of infections. And sometimes, I mean, there are bugs and germs on us, in us, everywhere, all the time, right? So you don't have to be out and be exposed, although that would certainly increase your chances of getting infection. But it's really common for my patients to get recurrent infections, chronic infections, even like herpes family viruses, right, which are dormant most of the time. We get stressed out, they reactivate. That stuff happens all the time. And yes, that causes inflammation. But also, your adrenals produce the main anti-inflammatory in your body, which is cortisol, right, which is a steroid, that's what all the steroids out there are mimic. They're basically cortisol on steroids, right? They're mimics of cortisol, just stronger sometimes. So your anti-inflammatory is your adrenals. And if your adrenals are taxed, you're going to run inflamed, right? Again, so the key to this is fixing that underlying physiology, not chasing the infections. Don't get caught up in that, because those are secondary effects, right? You got to fix that stress response system so that the immune system's not so suppressed anymore. Then you can get ahead of this little by little over time, okay? I think I answered the question. Okay. Karen says, if you have normal cortisol levels, is adrenal fatigue ruled out? Oh, that's a great question, Karen. No, not at all. So I have fielded so many patients who have previously gone to doctors who believe in adrenal fatigue. They even tested for it, and they tested the right way. Conventional medicine does a blood test, right? And that's even worse. Like, that blood test will only be off if you have complete adrenal failure, Addison's disease, which happens. It's very rare, but it does happen, right? JFK developed Addison's disease. But if you look through JFK's history, he had adrenal fatigue way before, right? When he was a kid, he was sickly, ulcers, asthma, chronic back pain, joint pain. I mean, he had adrenal fatigue until, I think it was the war and all that stuff that basically just put him over the edge, and then he had Addison's disease. Regardless, blood tests will only rule out Addison's disease complete failure. The best way to test for the adrenals is to get free cortisol levels, free hormone levels through saliva testing or urine testing. I tend to use saliva testing. I have seen those test results assessed and interpreted wrong hundreds and hundreds of times. And the problem is you have to look at cortisol, but you have to look at the balance. Cortisol should always be going down, never going up. And sometimes you have to infer what's going on because there's phases of adrenal fatigue. You also have to compare cortisol to some of the other adrenal hormones, which is imperative. And one thing you want to pay attention to is DHEA. DHEA is the tell. If your DHEA is low or low normal for your age, again, for your age, then you got to pay attention to that, right? Testing aside, with adrenal fatigue, if it looks like a duck, walks like a duck, and quacks like a duck, it's a duck, right? So don't give up. Make sure it's tested the right way and interpreted by the right person. A lot of variables there, but yeah. So normal test doesn't eliminate the possibility, okay? Okay. Excuse me. Anna says, I had an adrenal crash. I went keto too fast. My body got into shock. Now when I eat sugar or carbs, my whole body is vibrating, anxiety, like I have diabetes. That's basically just adrenaline. Not diabetes, it's just adrenaline. What can be done? What needs to happen in my body for the food sugar will enter like before a normal human? I think I have high cortisol in the morning and in the evening is low. Well, so you don't want to think necessarily, you want to know, right? You want to know where these cortisol levels are and everything that's going on. Going keto it's a pretty big shock to the body. One of the things the adrenals help with is metabolism, right? And our body's ability to use food for fuel. It's very easy for the body to use carbs, sugar and carbs for fuel because it's very few enzyme processes that just turn it into glucose. Whereas when you're looking at protein and fat, there's a more energy laden process, right? That takes a bit of an adjusting period. So, I mean, I can't give you specific advice, Anna, but whenever I make changes with my patients, I'm generally doing it in increments. Nothing too sudden, nothing too severe, because chances are that's going to affect your stress physiology, right? So, from a dietary perspective, if anybody has an adrenal problem, they've got to be on a hypoglycemic diet. Small, frequent meals, more protein and fat, low sugar and carb. It's pretty basic, right? That doesn't have to be keto, right? Keto is crazy low sugar and carb. And again, that's an adjustment period. But on the lower end, right, that tends to be what people need. And you don't necessarily, and your body will get used to how to use fuel, right? It's temporary. It's just adrenaline. It's not, probably not a dangerous thing necessarily, although as always, I would say, if you're concerned, go to your local doctor, get checked out, get tested, and just make sure everything's fine. I have the luxury of seeing patients who've kind of been through all their conventional doctors. They've been through all the specialists. They've been on that specialist merry-go-round, kind of the same that I was on. So by the time they come to me, they've ruled out anything dangerous. But if there's adrenal fatigue, right, and you suspect adrenal fatigue, then you should get it assessed and you should get it checked out. The thing with adrenal fatigue is that it's way bigger than a problem with your adrenals. And this is what the vast majority of people miss out on and they mistake. So you can't just take a little vitamin C and a little rhodiola or ashwagandha or pantothenic acid or whatever and fix a broken stress response system, because it's more than your adrenals. It's the pituitary, the hypothalamus, it's all those hormones. It's the entire autonomic nervous system. And it's this limbic system in the brain with the hippocampus, the amygdala, the insula. You got to fix all that, right? That's what fixes this little problem that we call adrenal fatigue. And I will say, conventional doctors, they know that this exists. They just use different words. And, maybe we'll get into that, but I don't want to dive into that too heavy. Okay. Good luck, Anna. It's challenging. And adrenaline's scary. Adrenaline is the hormone of fear, right? So you dump a bunch of adrenaline, like you're going to feel fear and worry, right? And be scared. And, it makes sense, right? Because if there was a tiger out you, the more scared you are of that tiger, the better your chance of survival, right? Thing is, there's no tiger. It's just some other kind of, minor stressors. So, if you have further questions, right, one of the things you want to do is reach out to us, right? Because I've got patient coordinators, right, who will do a free consultation, a free call on the phone just to see what's going on, see if there's a match. We still, we will treat patients for this. I've got several programs that I use to treat this. We've been doing this for, 20 years. So if you're confused and kind of bouncing around, reach out to us. Suzanne will put the information in the comments. Okay. Mark says, thanks. Okay. 33-year-old male, CMV, COVID, body hasn't recovered, fatigue, anxiety, tremors. Sorry, it's a long question. I'm going to run through adrenal cortisol. Can we have overactive adrenals to the point where they shut off? Generally not. But they're resistant. Yeah. Resistance happens, not looking well, not holding sugar. Okay. Brings me to other health issues, struggling with inner tremor, shaking inside. Again, I'm going to talk about that's adrenaline. Typically, for whatever reason, lots of reasons that we dump adrenaline. Could it be from high cortisol or low functioning adrenals? Yeah, it could be from any of that, unfortunately, Mark. So that's the challenge. Can you explain how the adrenals work in high stress situation and after the stress is over, and why they're still working hard, and how do we calm them? Okay, so how do we calm them is a big question, or the answer to that is big, because you have to deal with the entire stress response system like I was just describing, right? It's not like, oh, just take magnesium and that'll calm, and you're like, no, magnesium's good, but it's not going to fix all this stuff. So what adrenal fatigue actually is this stress response system dysfunction, right? What happens is with some genetic predisposition and just enough chronic stress over time to overwhelm those genetics, that stress response system gets trigger happy, especially in the limbic system. And what it does is the limbic system starts to overinterpret its environment as dangerous, so that minor stressors don't generate a minor response anymore, right? We make mountains out of molehills, which people with adrenal fatigue, they know what that feels like, right? Minor stress, major response. So what happens is our physiology literally gets stuck in fight or flight. I talk in terms of this fulcrum that governs this balance between fight or flight and rest and digest. And I give fight or flight and stress physiology and cortisol, and I give it a bad rap all the time, right? Because of all the damage it causes. Those hormones, they'll save your life if you use them once in a while, but if you dump them over time, it causes tremendous wear and tear on the body. And that's the problem. That's what leads to all the symptoms of adrenal fatigue, whether it's fatigue, pain, weight, insomnia, brain fog, anxiety, depression, it's all that stuff, right? So that's from the wear and tear, while at the same time, you end up suppressing the healing and repair side, right? So when our physiology is stuck, that's the problem. This fulcrum is spring-loaded towards fight or flight because we as humans are really good at survival. And it's been there so long, it's kind of rusted. So you try to shift it and it springs back. Shift it again, springs back. Keep at it. How to shift this physiology, again, that's a little more involved. There's a lot to that, right? We do have to look at stressors, and we have to look at kind of creating space in the bucket. That's kind of the key that when I'm working with patients, we have to create space in the bucket. This bucket of tolerance for stress, it has, your whole life is in this bucket, past and present. We got to create space. How do you create space? This is why your adrenal symptoms got worse, because you got sick, CMV, COVID, things flare, right? The bucket filled up. All right, we got to create space. Scoop out what we can, make the bucket bigger, right? That's healing the stress response system itself. And then poke as many holes in the bucket so that as stress keeps coming through, it just pours out, right? And that's working on stress physiology and coping mechanisms and all different kinds of things, right? But you have to do all of that, settle that system down so it's not so trigger happy. That's when you can start to shift. All right? Good luck, Mark. Okay, where am I? Anna says, I have a couple of questions, please. Could you explain the adrenal fatigue symptom stages, especially later stage? Also, would you recommend electrolyte drinks or salt? I tried LDN. I thought it was working really well, but it gave me the worst crash ever. I feel a bit more stable now. I'm off, but homebound, 15% functioning in the UK. All right, I'm sorry to hear that situation, Anna. It's tough. I get patients anywhere from 10 to 30 to 50, sometimes even 70 or 80% functionality. Those patients just need some tweaking and optimization, sometimes kind of as low as you are, and there's certainly challenges there. Different people talk about stages of adrenal fatigue in different ways. I just kind of simplify it to early stage, middle stage, late stage. And you can use your hormone levels to look at where those stages are. If you're talking later stage, you're generally going to have somebody who has less cortisol and less DHEA. Those are the kind of primary hormones. And what that means is that now those hormones aren't doing the job they need to do. And that's important because every cell in your body has receptors for cortisol and DHEA, which means every cell in your body starts to ground and screech to a halt, which certainly can become problematic in so many ways. And then again, you're going to look at all the symptoms. Usually later stage is going to be much more of the fatigue, kind of a little more debilitating, the kind of chronic pain, weakness, stuff like that. But you can still have some residual wiredness and anxiety. In the early stages, it's a little more of the anxiety, but the energy isn't completely as depleted as it will be later stage. All stages are uncomfortable, right? So all of them are uncomfortable. Now, The LDN, LDN can help with some basically endorphins and enkephalins, and that has an association with the stress response system. Probably gave you a bit of false energy, but it wasn't yours, right? Because it was coming from the LDN. So the key is you want to fix the adrenal problem so that the adrenals can help orchestrate the cellular energy production, so the energy can come from within. If you get energy from a pill, and this is a problem too with adaptogens, do this as well, even certain adrenal supports. If that increases, right? If that increases your energy, you got to be real cautious not to use that energy. So I noticed you're in the UK, and one of the big things I would recommend is the information and understanding everything that goes on in and around this issue. So I've got a few programs that I use to treat patients. I have a kind of a program that still involves me. This is kind of the Cadillac of what we do, which is based on the success we've had with patients who have come and stayed with us at our guest house here on our property. And that's how we used to treat all our patients. I mean, by the time those patients will go home, they'd already be feeling better. I mean, it could be a couple weeks, could be a couple months. They're not fixed. You don't fix this even in a couple months, but their physiology is shifting, and they can feel that shift, right? And by the time they leave, they would have a plan, an understanding of the plan, and then tools to implement the plan. So not only would they get better quicker, but they would stay better longer. And to me, that's what healing is all about, right? Know what you're dealing with, get a handle on it, know how to maintain it, and then get on with your life. Go live your life. Stay away from as many doctors as you can, including me. Now, the problem with that is that people don't have the resources, unfortunately. Not enough people have the resources to come and hang out with us and get that level of care, whether that's time, energy, or money, of course. So this is years ago now, probably 7, 8 years ago, I started working on a program hoping I could still duplicate those more successful outcomes those patients had, but so people wouldn't have to come here to make that happen, to try to make it more accessible to people. That's turned into my healing transformation program. I'm not going to go into the details of all that stuff. If you have questions about that, please just ask the question in the comment, and we can post links and do that. That's the best we've got. Comes with a little bit of a cost because it's a lot of work on our end. Just this year, I was able to introduce a step-down program called Core Plus, which is driven by my coaches. My coaches manage that. Now, my coaches have been through the original program. They have coach training prior to coming into me. And then I made them go through my coach training to treat this adrenal stuff, because it's different. Fixing adrenal fatigue is different than just about anything else. So you got to be cautious. Anyway, my coaches are amazing. So they handle that. You get testing, you get all the support that's needed to be able to heal from this. There's a step down from that called Core, which is basically all the information, right? So it's informational. Over the past couple of years, I've documented every bit of advice I've given any patient. I recorded it, I wrote it down, and I kind of trimmed it all down. I distilled it all down to the nuts and bolts and essentials of what people need. And even in that trimmed space, it's still an incredible volume of information. Again, because healing from this is different than anything else. It's not like getting sick and all of a sudden you just incrementally you feel a little better. That's not what this is. It's way bigger than that. So understanding what that process looks like is hugely important to getting well. So you can do it, but reach out. Core might be an option for you, Anna. Okay. Randy says, pardon me. I developed hypothyroidism approximately. Developed hypothyroidism, have some achy bilateral thigh pain. How common is myopathy with adrenal issues? Or is this more common with low thyroid? Well, I will tell you that the number one cause of hypothyroidism in this country is adrenal fatigue. Stress, we know this. right? We know this in conventional physiology. Now, unfortunately, I didn't learn it in med school. Most people don't. I was called out west to train some doctors to treat adrenal fatigue. This is 10 years ago now. And I knew what I wanted to say, but I got a little perfectionist in me, probably why I developed my adrenal problems, right? And so I go back to the research, right? And right there in front of me in conventional physiologic text, it says, when you're dumping excess cortisol, that cortisol goes to the hypothalamic pituitary thyroid hormone axis and suppresses it at every level it possibly can. And to this day, I have not had somebody with hypothyroid or Hashimoto's hypothyroid, whatever, that didn't have an adrenal problem underneath it. So what I would say, Randy, is look at the symptoms. I've got a symptom assessment tool on my website that you can plug in your symptoms and it'll spit you out. It's 4 or 5 minutes free. It'll spit you out the likelihood that, hey, you might have adrenal problems and some resources to go to look at that. So, and I guess to answer your question, myopathy, which is muscle pain and issues and weakness, is very, very common with adrenal problems. Very common. So now, Rachel says, how does EDS contribute to adrenal fatigue? Okay, so EDS, so people know, is Ehlers-Danlos syndrome. I actually think adrenal fatigue contributes to EDS. Right, so EDS is this, Ehlers-Danlos is this genetic predisposition to a variety of things. One of the big things is this ligamentous laxity, right? Well, if we look at adrenal fatigue and you look at the biochemistry and the metabolism of adrenal fatigue, cortisol and vitamin C are crucial components of connective tissue integrity. And when those, again, both are adrenal adjacent, let's say, when there is an adrenal problem, you will compromise connective tissue integrity. It is very common for my patients to say not hold chiropractic adjustments, to have hypermobile joints, things like that. And then if you have that person who has adrenal fatigue and then do this genetic testing, they're like, oh, you have Ehlers-Danlos. I mean, they don't have answers for what Ehlers-Danlos is anyway, right? But if you look at adrenal fatigue for what it truly is, which is beyond just the adrenals, the hormones, the autonomic nervous system, which controls your organs, and the limbic system in the brain, you'll find out that what people with Ehlers-Danlos, just maybe they have a little bit of a genetic predisposition, but I would treat that patient the same way and get after the adrenal fatigue, for what it's worth. Bethany says, let's see, it's been 7 weeks. This is a long one, so let me try to go through it. It's been 7 weeks, severe onset anxiety. I've had 2 iron infusions and noticed symptoms intensify. Yeah, I don't know. I mean, if your iron's low, you should get it up, but not necessarily if it contributes to those symptoms. But that might not be your biggest problem. Also, my throat's been red. I seem to have ear pain, popping ears when I swallow. Okay, infectious or allergy. Vestibular symptoms, louder tinnitus. Okay, can that cause no onset anxiety? No, I mean, causal, no, but maybe adjacent or correlates. Or can a viral issue cause EBV reactivation? Epstein-Barr is a virus. This is the 4th time this happened since 2018. Usually goes away about 6 to 8 weeks. I guess an internal doctor can help me figure out if it's viral, feeling hopeless. Okay, so here's the thing, Bethany. You want to try to step away from the ground floor and where all these symptoms are coming and going and making you a little nuts and uncomfortable, which I get, and try to step out of that and look at this from a big picture perspective. Because when you understand kind of what adrenal fatigue is and with regard to this stress response system dysfunction, you can see then that when the body's in stress physiology, what that stress hormone does. First off, it's stress hormone, so it causes anxiety, depression, messes with your sleep, does all kinds of weird things that way, right? But what it also does, and this is well documented in conventional physiology and conventional journals, Stress physiology suppresses your immune system. Suppress your immune system, you're going to have increased likelihood of Epstein-Barr reactivation, viral reactivation, or just susceptibility to catching a cold or getting an infection. And in addition to that susceptibility, you also will develop allergies or sensitivities to things. The thing is to ask, I always ask why. Okay, because my Epstein-Barr used to reactivate all the time too, right? And conventional doctors would treat it, then naturopathic doctors would treat it. Naturopaths were nicer than the conventional doctors for the most part, but they were still chasing after the Epstein-Barr. So I would feel a little better, but then I would get sick again, whatever it is, 6-8 weeks later. And then I would do it again, right? And eventually I just kind of put a halt to that because I started to think, okay, if everybody in the country tests positive for Epstein-Barr, which we do, everybody in the country has had or been exposed to Epstein-Barr, why does it keep bothering me and not my neighbor? The problem's got to be me because it's the same virus. All right. So if the problem's me, what's the problem? The problem is my immune system isn't strong enough to keep it dormant, like you have to do with herpes family viruses. Okay. Let's take it a step further. What controls the immune system? That's stress physiology. Once I figured that out and I found my predecessor's work and I started working on fixing this adrenal fatigue, this problem with the whole stress physiology, I didn't have to worry about Epstein-Barr or all this viral stuff again. Yes, you can go to your conventional doctor. They can treat you for the viruses, but you're going to keep going on that roller coaster forever until somebody helps you fix the underlying problem. That's what we do. Fix the underlying problem. Get off the hamster wheel, get away from all these doctors, and get back to living your life. I hear it all the time in my patients. I just had a conversation with a patient Monday who's been with me 6-7 months now, 6-7 months. And I can't tell you how many times she thanked me for the program that we put together to help her. Young, 45 years old. Right, 45 years old. She waited to have kids, and she's got a history of some adrenal things up and down. But more recently, it's been pretty bad since COVID and since a bunch of other stressors. And everybody's chasing that. Well, maybe it's COVID, it's long COVID, it's Epstein-Barr, it must be your anxiety. And they're chasing after all this ancillary stuff, right? But it wasn't until we finally sat down and explained and made those connections and made those changes, and she was able to shift this physiology. I mean, she did what I asked her to do, which is not always the easiest thing to do, but she is so thankful. She's like, I can live my normal life again. Within 6 months, I can live my normal life again. You can do that. You can get ahead of this. You just need somebody that knows what they're doing. That's the problem, Bethany. It's hard. Good luck. Good luck. Okay, Lila says, how am I doing on my time? Oh boy, I got a lot of questions. Speed it up, huh? Lila says, I am sure I have adrenal fatigue, but my doctor does not agree with this, thinking, what am I to do now? I know. If you ask any doctor worth their salt and you talk about the symptoms, that's what they pay attention to, the symptoms. And you just ask them, does stress cause anxiety? Oh yeah, of course. They know that. Does stress cause depression? Oh, sure. Does stress cause weight gain? Of course. Does stress cause sleep problems? Yes, they know that happens, but that's where they stop, right? They stop at the symptoms. It's like, take this for your sleep, this for your anxiety, this for your depression. What they don't go to, and which is well documented, is your stress physiology itself can get broken. That's what adrenal fatigue is. And I try not to get caught up in the semantics. You want to argue with me that adrenal fatigue doesn't exist? Fine. I don't care. What do you want to call it? Do you want to call it central sensitization? Do you want to call it glucocorticoid resistance syndrome? Like, they got all these, the names don't matter. But if your physiology is here, that's a problem, because that's going to cause all the symptoms. So what happens is you got to walk away from a doctor who's not listening to you and who is not going to help you, right, with the underlying cause of your problem. And I don't blame these doctors completely. They are stuck in a horrific system. I mean, they give them 10 minutes to see a patient. You can't figure all this stuff out in 10 minutes. It's horrible. And some of them are victim to it. Okay, so I do have a growth, Lila, again, I do have a growth in my adrenal gland, possibly clinical Cushing's. And Cushing's is just too much cortisol. I can't get to an endocrinologist till next year in June. That's ridiculous. I can't sleep till around 3 or 4 in the morning. Tired all day. Yeah, I mean, you need to see. So I wouldn't wait till June to fix this thing. You absolutely want to reach out, please. The main program that I use to treat this condition, which gets testing and the support and guidance you need, is our Core Plus program. It is accessible. You get volumes of information. You get access to this information forever. It is truly an effective program to get after this. Reach out to us. We can put the link. Suzanne will put the link in the comments. You need guidance. Don't accept the suffering, right? Don't accept it. You can get better. You don't have to live like this. I understand the misery. I do. I've been there myself, and I've seen thousands of patients. I've heard thousands of stories just like you, where people they're going through it and they're dismissed by their doctors. At best, they're dismissed. Sometimes they're actually ridiculed and shamed. I mean, it's horrible, the stories. But even if you leave conventional medicine and go to alternative medicine, they're still chasing after all this secondary stuff. You got to detoxify, or it's candida, or it's that Epstein-Barr, or the Lyme. I just had a patient, and I talked about this on a YouTube live, where she had these light bulb moments go on as we were having our conversation. And she's like, wait, she's putting all the pieces together. I could see the gears spinning. She's like, it's not the Lyme? I'm like, you've been treating Lyme off and on for 17 years, sometimes very aggressively. 17 years, you're on disability. Like, Lyme's not that confusing. Kill it, right? Kill it and you'll be better. If Lyme was your problem, you'd be better already. Like, there's more to it, right? And then she's like, Epstein, it's not the Epstein-Barr. I'm like, no, everybody has Epstein-Barr. What about the candida? No. So don't accept, right? If it doesn't make sense to you, trust your gut, right? Trust your gut. Get answers. The answers are out there. And we do everything we can to answer as many of those questions as we can, whether it's here or, YouTube channel, or definitely in the program. So Kathy says, I believe the 12 years I've been dealing with fibromyalgia is likely adrenal insufficiency, aka adrenal fatigue, 100%. Fibromyalgia is a garbage can diagnosis. It's meaningless. It doesn't tell anybody anything. Conventional medicine doesn't know what causes fibromyalgia. They just ruled out every other cause of pain. And they're like, let's call it fibromyalgia. They don't know what to do about that. We do, because if you take somebody with adrenal fatigue to the nth degree, right, a number of those patients, half those patients will develop chronic pain, and eventually they can hit the CDC criteria for fibromyalgia. Another half will develop chronic fatigue to the point where half of them will develop the CDC criteria for chronic fatigue syndrome. And some people have both. Who cares about the names? The names aren't important. You got to treat the cause. Sorry. Is it possible all my symptoms resolve when my hormones are stabilized, even if it takes a year? Okay, so yes, it's possible. When you say hormones, I'm not sure what you mean. Are you talking adrenal hormones, ovarian hormones, thyroid hormones? But yes, and I would say the adrenal hormones are most important, because as goes your adrenals, so too will go your thyroid and your ovaries. And we know that. That is conventional physiology. Stress hormone suppresses thyroid and ovarian function. And many well-intentioned doctors, they're like, oh, well, your ovarian hormones are off. Let's try to fix those, right? If you're successful in that at all, you're going to have to do that forever, because you're not fixing the underlying problem, which is the adrenals. And the adrenal problem is going to make things worse over time. So maybe you don't see that problem, right? But other problems exist. 100%. You can get ahead of that. Okay, 15-minute warning sign. Here we go. Okay, Becky says, Okay, muscle weakness and I'm going to go quicker. Muscle weakness and feeling like your body's made of cement, post-exertional exhaustion, fit. Yes. I read somewhere instant post-exertional is more the adrenals, delayed, more inflammation. Same thing. They're splitting hairs. You will have inflammation if your adrenals the main cause of inflammation is going to be a problem with your anti-inflammatory. That's your adrenals, right? 5 months, worst crash, hardly improving, hard to know, expectations, progress, post-COVID, some improvements, brain fog in a bad place, hard to look after my child, struggling. Yeah, I'm sorry to hear you're still struggling, Becky, but long COVID, that's adrenal fatigue. COVID's just in the bucket, just like Lyme, Epstein-Barr. I've talked about that, right? Post-exertional stuff, your energy is depleted. Don't push beyond. If you continue to focus on this underlying problem and the basics, right? The basics are key. The basics, right? The diet, the salt, the lifestyle stuff, right? The basics are key, and then supplementation on that. It will come in time. You do want to be cautious with your expectations, right? One of the stressors that we have is our expectation of what healing is going to look like versus what healing from adrenal fatigue actually looks like. It takes time. Should the expectation, we expect to have no symptoms at all before doing things, or just lesser? I've been doing some nervous system regulation things, but I can't work out if some of the symptoms are okay or normal. And you don't have to be symptom-free. Just don't let anything exacerbate, right? Don't push. If things make you feel worse, it's probably not right. Don't push through whatever it is that you're doing. But no, you don't have to be symptom-free to be able to do more, but less is more. Everybody needs to rest, pace, right? Pacing is the key. Do a little, rest a little, do a little, rest a little. Absolutely, we all have to avoid the go crash. Sound familiar? For most of us, it does. You do that go crash, you end that day with a net loss of energy. Or you could do a little, rest a little, do a little, rest a little, do a little, rest a little. Every rest means you recover from the previous work you've done, and you can avoid that crash. And you can end that day neutral, maybe even a net gain. So you want to avoid the crash. Kelly says, I'm struggling with chronic bladder inflammation, interstitial cystitis, and digestion. Please with any suggestions. Many thanks. Okay. So stress physiology, stress hormone damages the protective layer of the mucosal membranes. It's called mucin. Mucosal membranes are all over the body, respiratory, digestive, genitourinary. Because of that damage and a suppressed immune, suppressed digestive system, most of my patients will develop something lovingly called irritable bowel syndrome, which is another one of those garbage can diagnoses, right? Like they ruled out everything else. We'll call it IBS. We don't know what to do about it. Good luck. We know what to do about it. Let's stop suppressing the digestion, right? Some people will also develop irritable bladder syndrome. And we give all kinds of names to that: interstitial cystitis, pelvic pain. There's a lot of different things. So the key, right, to that is not damaging that protective lining, which is fixing the underlying problem, right? Fixing that stress physiology that's going to contribute to that over time. But I will say one of the things I like quite a bit is bone broth. Bone broth, it's like slippery, mucilaginous, right? The constituents of that mucin lining, they're called glycosaminoglycans, these little gags. They exist in bone broth. So doing bone broth, it kind of paves this road, like a road full of potholes. It paves the road again and again and again and again, and then it can rebuild while you're fixing the underlying problem. So bone broth is one thing that can help. So Lynn says, will you use Dutch test for adrenal function rather than saliva test? Sometimes Dutch test is urine testing. I use saliva testing. Saliva tests have not proven accurate or helpful for me. That's probably because you have the wrong person interpreting your saliva test. Not all saliva tests are made equal. I mean, I tend to stick with this one lab, but I can almost guarantee, Lynn, I've seen it so many times, it's the interpretation of the test that's a problem, not the test itself. But were you my patient and you said, I've done these saliva tests, I'd probably look at those and say, no, here's the problem. But if you said demanded, I'd like to do the Dutch test. Sure. It's the same thing. Free cortisol, right? Free hormones, right? Whether it's urine or saliva. So not a problem. Kathy says, how's our 10 minutes? I'm having hot flashes. And thanks for sticking in with us. By all means, let us know who you are, where you're from in the comments. Please. We love to hear. I'm having hot flashes in just about every symptom you mentioned. Sorry to hear that. My naturopath checked my blood pressure sitting and standing and said I don't have adrenal issues. Might have to find another naturopath. Is there something I can show her to convince her? Look, I went to naturopathic medical school before I knew I had adrenal problems, and I was seen by some of the best naturopathic minds in the country, and they were still, loved them to death, but they were still chasing after my Epstein-Barr, my anxiety, my malabsorption, my leaky gut, my food allergies, my candida, all this ancillary stuff, secondary stuff. So unfortunately, just because you have a naturopath that you're working with doesn't necessarily mean they get this in its entirety. And unfortunately, most doctors don't, naturopath or otherwise. Is there something I can show her to convince her? Probably not. I mean, you want to get testing on the side and then show it to her. But does that mean she's going to know how to fix it? Probably not. If she doesn't know how to assess it, she's not going to know how to fix it. Right? Like, I get it. She's doing an orthostatic test. You want to do one lying down, not sitting, lying down and then standing. But that only tells us that's like a little snapshot of what's going on. I mean, I'd find a doctor who believed you and who knows more. I hate to say that. Okay, Steve says, apart from fatigue, my most concerning disruptive symptom is being awakened REM sleep, early cycles, adrenaline, PVCs, GABA-theanine helped. Today I had one of these episodes at 5. Does this symptom sound like a stress response? Yes, my patients have this all the time. These supplements aren't addressing the root problem. No, they're not. But do you think they're a good choice? They're fine. If anything helps you sleep, it's fine to use it. But there's a deeper problem that you should get to, right? Because you're covering up a symptom. That's what you're doing, which is fine. But you're like putting a piece of tape over the check engine light in your car. If you don't fix this physiology, you're going to continue to dump that excess stress hormone. It's going to continue to cause damage, and eventually that GABA-theanine is not going to work. And so you've got to fix this underlying problem. Is there anything else you would recommend? Yeah, Steve. I mean, I would recommend fixing the underlying problem. Fix this broken stress response system. Is there some magic supplement I can tell you to fix that? There isn't. There isn't, right? You have to hit it from every angle you possibly can. I wish it was easier. I wish I could if I could have a supplement that would fix all this, we would solve a lot of problems, wouldn't we? It'd be so easy. It's not. There's no supplement that fixes this, but there is a process. There is a process, and I'll tell you, we have fine-tuned that process. I've been doing this for 20 years. 20 years, I've had suffering patients sitting right in front of me. Doc, I can't sleep. I got anxiety. I'm miserable. I can't take care of my kids. I can't work anymore. I can't think straight. I've had thousands of those people in front of me, and I've been able to help to guide them incrementally on their way back to health. So you can do it. The thing is, it's just different for everybody. And chances are you need somebody to guide you who knows what they're doing. All right. Okay, YouTube poll. Thank you for voting on the YouTube poll. People voted to learn about what exercise is recommended for adrenal fatigue patients. Oh, exercise is a very challenging thing with regard to adrenal fatigue because exercise is a stress on the body. It's a good stress. It's a good stress. We want to stress the muscles. We want to stress the heart, break them down. They build back stronger. Exercise is good. I'm a huge proponent of exercise, except with regard to people with adrenal fatigue. Because if you've got somebody's bucket who's full and you add exercise, that's a stress, right? But you're adding a stress to a bucket that's full. Even if it's a good stress, that can be a problem and you can feel worse. Biggest thing with exercise is you can do the exercise that doesn't make you feel worse. I tell my patients, I want you to move as much as possible, but not more. Boy, that's a fine line. It's really easy to overdo it, especially if your functional capacity is way down here. You've got adrenal problems. You've got mitochondrial damage that we haven't repaired yet. Your body can't produce energy. It can't get lactic acid out of the cells. If you do something that makes you feel worse, back off. Back off. Let things balance out. You can do it again. The exercise that's okay for patients, typically, a little bit of walking, a little bit of stretching. I tell them you could flop around on the ground a little bit just to get some blood flow to those muscles. Okay. You're changing. Okay. Joe says, is there a particular acupuncture treatment you recommend? With some more comments. No, I do like acupuncture. I find acupuncture to be balancing. That's really kind of the key, right? Balance the meridians and normalize, chi or whatever you want to call that, right? I find acupuncture to be somewhat of a helpful adjunct therapy for this. I certainly don't mind acupuncture, but I'm not an acupuncturist. I don't know. But it's all about balance, right? That's this condition is all about balance and shifting that physiology. And that's usually what acupuncture is about. So, I wouldn't have them ask you what you want, right? Let them look, I'm trying to optimize my overall physiology, right? Tell me where the imbalance is, read my tongue, read my pulse, whatever they do, bring me back into balance. That's the key. Okay, Dirk says, hi, Dr. Neville. If it's exclusively HPA axis dysfunction, which is really more than enough, then healing is, in short, about regulating the trigger-happy, friendly limbic system, ? Well, it's more than that, but it does include the trigger-happy limbic system. I'm assuming that I'm already doing everything else, diet, exercise, everything you recommend anyway. Okay, that's a big assumption, Dirk, but if you want to assume that, you can. Can I bring my nervous system back to calm on my own? Or, as you often mention, that you as a doctor expand the capacity of the system. What exactly do you do to achieve this? The thing is, Dirk, it's different for everybody, right? What I have to do with patients when I get patients in front of me is we have to figure out what everybody's therapeutic puzzle looks like, and then put enough of those pieces together all at the same time. When we do that, this physiology shifts. The symptoms that come from stress physiology, they start to decrease over time in intensity, frequency, and duration. And then as we turn on the healing and repair side of physiology, patients feel more of themselves with increased intensity, frequency, and duration. There's some common central pieces of everybody's puzzle. So I do talk about those pieces, and I talk about that a ton on my YouTube channel. So the basics are there, right? So those are key. Beyond the basics, everybody's puzzle starts to look differently. It starts to change. So that's where maybe the art of fixing this comes in. And typically what that takes, when I used to have patients come and stay with us, they'd stay at my guest house. They'd be with me for a couple months. They'd be in my office every day for a couple months. We get to know each other, right? No stone was left unturned. Like, we talk about thought processes and belief systems and, are they pushing themselves too much? Is guilt making them fill their bucket up too much? Are they still being a perfectionist? Or do they think they eat a healthy diet, but they're, doing intermittent fasting and they're messing with their blood sugars? Or like, everybody's puzzle is a little bit different. And that's where the guidance and support tends to come in. here's the thing. If I'm no rocket scientist, right? But I've been down that path hundreds and thousands of times. I know what the detours are. If this doesn't, I know how to go this way, right? I've been down those various paths, and I've trained my coaches to do the same thing. Having an idea as to where you want to go is a good thing, right? But you need to have a path and then maybe a guide to get you through that. That's what we offer. Like, we are kind of that guide. If you've reached a certain level and you're not getting better, then you need some kind of an assessment and somebody to guide you a little better. So what I would strongly suggest for you, Dirk, is to join Core Plus. It is the most effective, cost-effective, efficient way to get ahead of this. Truly is. It truly is. Okay, I apologize. I did not get to every single question. Boy, did we have a ton of questions, which is awesome. Thank you very much. Please stick with it. Continue to find answers. If you have further questions, by all means, reach out to us, whether it's in the comments. Go to my website, go to the YouTube channel, get educated. But remember, knowledge is one thing, right? Information is one thing, but without the ability or the knowledge or the wherewithal to act on that information, you don't get anywhere. You can get ahead of this. You should get ahead of this. You deserve to get ahead of this. It's probably going to require some expertise. That's what we provide. All right. Good luck, everybody. All my best.